Many veterans, especially younger women veterans, rely on VHA for contraceptive care. Of course, reliable, uninterrupted access to information on a range of contraceptive outcomes and to contraception is essential women's health care. But in the middle of a global pandemic, seeing your provider for a refill of your prescription and visiting a pharmacy even can be really challenging. And so, what steps has VHA taken to prevent gaps in contraceptive coverage during this pandemic? That question's for Dr. Hayes.
Thank you, Ms. Underwood. Thank you so much for that question. We actually not only perceived that that might be an issue, but we took action immediately. We have providers working to actually fix the system ahead of time so that they don't run out and getting more refills available. Our prescriptions come by mail. If it's an injectable, we've actually changed over the mechanism. Some places had drive-through injections for the contraception, and in other situations, we've changed the formulation so that the veteran can self-inject and receive that injection by mail, and then using video telehealth with the nurse or the provider to make sure they're doing it correctly the first time. So we really are concerned about contraception during this time and have done quite a bit to take that challenge on.
Thank you. Last year, VA published a study with the University of Pittsburgh on a one-year dispensing option for oral contraceptives. The study found that dispensing a year-long supply rather than just 3 or 4 months worth improves health outcomes for women, and it lowers the cost for the VA. And in a pandemic, it could also potentially decrease a woman's risk of disease exposure. Dr. Hayes, has VA looked into expanding one-year contraception dispensing during this pandemic? And if so, how many women currently served by VA have this option?
Hello. Right now, VA does not have the 12-month dispensing option, and it's tied to both internal policy, which we can fix, but also the copay options. As I said, though, a person gets 12 months, they just get them every 90 days, and so their lower copay is attached to that, and we need legislative relief to deal with that. I might also say that we've actually been looking into that study with Pittsburgh, and there actually isn't data that shows that the lack of the 12-month in any way increased the number of unintended pregnancies. And that's another piece that we have to take a look at to make sure we can actually look in our data. We're setting that up to take a look at that factor. So we want the health of the woman to be improved. We want her to have easy access to contraception. And we also want to make sure that we're helping her with unintended, unplanned pregnancies. So all of those factors are going into this current effort.
Yes, ma'am. I'm really glad to hear that you're looking at all the potential clinical outcomes, of which unintended pregnancy is just one purpose of a woman taking contraceptives. I would encourage VA to prioritize expanding one-year contraception dispensing. It's an evidence-based practice that improves women's health and saves money. As you know, I have a bill on this issue, the ACE Veterans Act, and I'm looking forward to working with VA to make year-long dispensing a reality for VA patients. I also want to discuss our nation's maternal mortality crisis and how this impacts women veterans. The number of women veterans served by VA is growing rapidly, but there's still not enough demand to provide obstetric care in VA facilities. So VA partners with community-based maternity care providers. It's essential to ensure that these community providers are held to the highest standards of care. Dr. Hayes, what specific steps is VA taking to prevent adverse maternal health outcomes, including maternal mortality and severe maternal morbidity among women veterans receiving care outside of the VA facilities?
I'd actually like to turn that to my reproductive expert here who's helping us track our maternity care in women veterans, Dr. Christie.
Thank you for that question. As you know, we have maternity care coordinator program who help coordinate the community care and the care within VA. And as Dr. Hayes mentioned earlier, all of these women were contacted during the pandemic to provide resources and information to them. As we mentioned, we are also collecting the data on obstetrical outcomes, and that will help inform recommendations going forward. But we are very proud of, and we feel the program has been very successful with the maternity care coordinators, and it is a program that the veterans have been very happy with, and we feel that the quality of care that they are able to receive with the coordination of the MCCs has really been outstanding. And we think that that will go a long way in not only care coordination, but improving outcomes.
Thank you, Dr. Christie. The Protecting Moms Who Served Act, bipartisan legislation that I introduced with my colleague on the Women's Veterans Task Force, Dr. Billy Rockus, would provide funding to support maternity care coordination through the VA. And with that, I yield back.